Okay, that's recording.
I call this a special session of the Employee Council to order at 10:09 a.m. in the Cochise County Board of Supervisors hearing room at 1415 Melody Lane, Building G, Bisbee, Arizona. Yvonne Ward. Here. Rochelle Davis.
Here.
Joe Ward.
Here.
Ramon Barbone.
Here.
Officer Ritchie.
Here.
Officer DeFord.
Here.
Daniel Ducharme.
Here.
And Nina Williams. Here. The following items will be discussed, considered, and/or decided upon at this meeting. Discussion and possible approval of the minutes of the November 14, 2018 meeting of the Employee Council. Do I have a motion? I move to approve the minutes from the November 14, 2018 meeting of the Employee Council. Do I have a second?
Yes, I'll second.
All those in favor?
Aye.
Item number 2 is the Cochise Combined Trust presentation and employee question and answer session. Thank you and welcome.
Thank you, Madam Chairman, Chairperson. Good morning. My name is Stephanie Moore. I'm with Aaron Collins and Associates, and we are the broker consultant for Cochise Combined Trust, which is a self-insured public entity pool that consists of Cochise County and Cochise College. So they pooled together back in 2002 to create a benefits pool to spread the risk over a larger group of people. So they are self-insured, which gives them a little bit more control over benefit changes, plan design, and the rates. So that's the big global reason why entities may go self-insured. We were contacted by the City of Bisbee to ask what it would take or how it would look if the City of Bisbee considered joining Cochise Combined Trust. So that's why we're here today, just to give you an overview of how the core plans compare. And then I'll spend a little bit of time on the other plans that are available, the rates, and dental. But I should also just start with the actuary. All the rates are determined actuarially, and the actuary has already determined that the City of Bisbee is fit for Cochise Combined Trust. The Board of Trustees of Cochise Combined Trust met and approved City of Bisbee joining the trust. So at this point, it's in the hands of the City of Bisbee to decide whether you want to go forward. And these meetings are designed to provide information to you so that you can ask questions and let the city management know how you feel about going forward with this. If you have any questions during the presentation, just interrupt me and ask me at the time. I think it's always easier when it's front of mind than it is later on. So to start out with, what we're going to be comparing is Cochise Combined Trust EPO, which is an exclusive provider organization, compared with the City of Bisbee core plan. Okay, so the biggest difference between the two, just from the get-go, and I think I have a slide that gets this later, but exclusive provider organization means basically in the state of Arizona, the only providers you can use are Blue Cross Blue Shield of Arizona. There is a WRAP network for outside of Arizona coverage that is considered in-network, but inside Arizona, there is no out-of-network coverage. So on the EPO, the CCT plan, the deductibles are $500 for an individual, $1,500 for a family. So if you're just 2 people in the family, it's $1,000, right? So it's about $500 per person, up to $1,500 for the family. On the Bisbee plan, it's $1,000 for an individual, $2,000 for the family. Max out of pocket, a little bit less on the individual, $3,500. A little bit higher, maybe a little bit more than higher, on the family on the CCT plan. Office visits, $25 deductible on the CCT plan, $20 on the Bisbee plan, and then the opposite for a specialist, a little bit lower on the CCT plan. CCT uses Teladoc for their telemedicine. The first 2 visits on the EPO plan are absolutely free, and the idea behind that is if you don't have any risk, you're willing to give it a try. So you go ahead and give that telemedicine a try. Most people that have tried it found out it's a pretty good process for seeing the doctor while you're in your office or your home in the middle of the night or whatever. After that, the visits are $45. And then on the Bisbee plan, on the telemedicine is no charge. But I'm not familiar with the details on that one.
I do have a question, Stephanie.
Yep.
Just to kind of answer some basic questions. Could you give us an example of like a deductible and non-deductible expense? Like what starts counting towards that 500 and what does not?
Okay, so basically if you think about major medical, anything that hits your co-insurance is going to go to your deductible. So co-pays, so if you go pick up a prescription, you go to the doctor and you pay a $25 copay, none of that goes towards your deductible. But let's say you go to the emergency room and you have co-insurance, or you get admitted to the hospital, you have a surgery, you have advanced imaging, those kinds of things that go to your, anything that goes to your co-insurance is going to go to your maximum out of pocket and your deductible. Does that help?
Yes.
Okay, I know it can get super confusing. That's my job security.
And just to add on to that, not to interrupt, the city, we have our own things like the HRA, the health
Right.
reimbursement account, the cafeteria plan. Those are still decisions that we and the council can make and have. So with the deductibles changing, we can still do the HRA reimbursement and the cafeteria. Sorry.
Okay, so preventive care, one of the things that the trust believes in heavily is preventive care, catching those large claims before they become claims, so catching cancer early on. Those kinds of things are, they not only, I mean, looking at things from a financial standpoint, they save the trust money, which controls premiums, which keeps them low for the long run, but it also saves people's lives, which is the really important part, catching things early. So, of course, the plan covers everything that's covered by healthcare reform, as your plan does now. But the plan also provides for an extra $500 towards wellness that is not covered under healthcare reform. So, there's various types, and I'll get into that at a later time, but it pays first dollar on all of our plans, $500 extra over mammograms, flu shots, those kinds of things are covered under healthcare reform. But let's say a skin cancer screening, organ and cardiac screenings, healthy heart draw to know what your numbers are, those kinds of things, not covered under healthcare reform, but can be charged that $500 wellness. And we actually bring those things on site so that everybody can take advantage during their work time and get those results back. The trust also provides for an annual health risk assessment and your biometrics covered at 100%, and it is not charged to your $500 wellness. So again, it's one of those opportunities to know your numbers, know what you need to be working on before you develop some kind of a chronic disease. Of course, the City of Bisbee covers everything that's covered under healthcare reform, but I didn't find anything in the plan that goes above and beyond that. So just a little bit comparison on lab and x-ray. For the CCT plan, lab and x-rays under $500 go to a copay, okay, and that's $500 on allowed charges. So after the Blue Cross Blue Shield discount, what's allowed, if it's under $500, it's copay. Specialists are $35, and all other locations are a $25 copay. If it's over $500, a single test over $500, it goes to co-insurance and deductible. So that's kind of what Dan was talking about earlier, where if it's a more expensive test, then you're gonna pay your deductible and then co-insurance. All of those things go towards your max out of pocket. If it's advanced imaging, so the really expensive stuff, it goes to, again, 20% after your deductible. So co-insurance and deductible. On the city plan, diagnostic lab and x-ray, a $25 copay, and then advanced imaging, it's a $500 copay and the deductible is waived. Okay, so you may think, I mean, you can look at this one way or another. The way I like to look at it is your deductible is your deductible. So once you've satisfied your deductible for the year, it's gone. So if you have a $600 deductible, once you pay it, or a $500 deductible on the EPO plan, it's paid. And then you're just doing co-insurance and your max out, until you hit your max out of pocket. If you have a copay, you continue to pay copays. So on the city plan, you pay a $500 copay, but if you had to have another one of those, you would pay another copay. Okay, so it's a little bit different. Any questions on that? Because that's a little bit confusing. Yep.
Co-insurance, kind of break that down.
That's the 80-20 part.
Okay.
So once you get to a co-insurance part or your cost sharing, that's your 20% up to your max out of pocket. Okay, so urgent care. $50 copay for the CCT plan to go to urgent care. Same on the Bisbee plan. Emergency room, again, this is a little bit different, much like the advanced imaging. ER on the CCT plan is a $100 copay, and then 20% co-insurance after deductible. So you go to the ER, you're going to pay the copay, your deductible if you haven't already satisfied it, and 20% co-insurance up to your max out of pocket. However, if you get admitted to the hospital, that copay, that $100 copay is waived. Okay, so you don't have that copay. And really the thinking behind that is, if you get admitted, you really did need to go to the ER. Okay, and what we found in rural areas is the utilization of ER in some cases becomes the doctor's office because you don't have facilities like in Metro Phoenix or Tucson that are open 24 hours a day, that are urgent care or doctor's offices. So people tend to put things off, and then at midnight they become, all right, I need to go, even though that was something that probably could have been handled in an urgent care. On the City of Bisbee plan, the emergency room, again, like advanced imaging, has a $400 copay, but the deductible is waived. So again, every time you go to the ER, you're going to pay that $400 copay. So it doesn't ever get applied to your deductible. And then on ambulance, 20% coinsurance, deductible waived, and then on the Bisbee plan, 10% coinsurance after deductible, so you have to pay your deductible. So lots of little things in the differences in the plan. The bottom line is, that maximum out of pocket. So once you hit that on your coinsurance, combination of copays, deductible, and max out of pocket, you're done paying for that plan year. Any questions on the ER's emergency services? Okay, so hospital services, 20% coinsurance after deductible on the CCT plan, and 10% coinsurance after deductible on the Bisbee plan. So you're going to pay less for each bill up to your max out of pocket on the Bisbee plan. And then the same thing, the same percentages on inpatient physician or surgeon fees. So mental health services, inpatient services are 20%, and you'll see this all the way through the plan. The co-insurance, basically the general payment rules on the two plans are 80-20 on the CCT plan and 90-10 on the Bisbee plan. Outpatient counseling, if you go to a psychologist, therapist, counselor, it's a $25 copay, and if you go to a psychiatrist on the CCT plan, it's $35, and outpatient counseling on the City of Bisbee plan, $20. Okay, so I alluded to this a little bit earlier on the EPO plan. So no coverage for out-of-network inside Arizona. So if it's not in Blue Cross Blue Shield of Arizona, it's not covered inside the state. The CCT plan has PHCS, which is a nationwide network that covers you when either traveling out of state or let's say you need to see a specialist in Las Vegas or somewhere. As long as it's on PHCS, it's covered as in-network. And then emergency, of course, is covered as in-network anywhere you go. So if that's where they take you, you don't have to worry. You just have to worry about getting well. So on the City of Bisbee plan, you do have out-of-network coverage, so you could go to a facility in the state of Arizona or a provider that is not a Blue Cross Blue Shield of Arizona provider or United Healthcare provider. But you have a different and separate deductible, so you have to satisfy that separately than your existing deductible. And then your co-insurance is 50%, so the plan pays 50%, and you would pay 50% up to those $10,000, $20,000 per family max out of pocket. I don't know, we don't find that there's a lot of out-of-network utilization inside the state because the networks are generally pretty good, so. When it comes to prescription benefits, copays are pretty much the same until you get to a non-preferred brand, so $10 more on the CCT plan, and then specialty is a little bit less. Problem with specialty copays that get high is that people who are on specialty meds, they really need those medications, and if the copay becomes too much for them to pay, they stop taking them, and then they get sicker, and then it costs the plan more. So that's why, that's one of the reasons that we try to keep that specialty copay low, is to make sure that those that need those medications adhere to what the doctor's orders are and taking them. And so then for CCT, any pharmacy that you go to that is not a network pharmacy, which is practically all of them, it's an additional $5. Any questions on prescription?
Yeah, so does that specify do we have to take it to a place that takes Blue Cross Blue Shield on the pharmacy? Or?
No, no. You would go to Safeway or wherever you normally go.
I was going to say, yeah, because Bisbee's a little limited.
Yeah, no. Let me put it this way. All the folks we have on the same pharmacy benefit manager platform, which is Navitas, we have Cochise County, Cochise College, and the city of Sierra Vista, and we don't ever have any problems with employees or their dependents finding, like everything is in the plan, so. All right, so a couple other things. CCT has a multitude of other plans, okay? So they have a high deductible health plan. And these decisions, how many of these plans that if the city decides to go forward and join CCT, you guys can make that decision, or your city can make that decision of, we just want to do the EPO, or we just want to do the EPO and the buyout, or we just want to do the EPO and the high deductible. There's 4 plans altogether, but you don't have to offer them all. Okay, so the city can make that decision. But we do have a high deductible health plan. It has deductible of $3,000, $6,000. If you're not familiar with a high deductible health plan, you pay first dollar all the way through until you hit your deductible. Okay? On this plan, which is super simple, once you hit $3,000 as an individual, it's all covered 100%. Whatever's approved, whatever covered on the plan is paid at 100%. These plans are qualified under the IRS to have a health savings account. So that gives you the opportunity to put that money away before taxes, and so that you can pay those deductibles. I mean, it's the plan I have, and I've had it for years, and frankly, I love it. I wouldn't have it any other way. I don't have to worry about co-pays or co-insurance or anything else. Then on the on-site screenings, right now CCT does health risk assessments, flu and pneumonia vaccines, cardiac and organ screening, skin cancer screening, a healthy heart blood draw, which is like 6 months after the HRA biometrics, a comprehensive eye exam, which is not like a seeing exam, it's an eye health exam, and a lot of really contentious diseases show up in the eyes first. So with a comprehensive eye exam, you can actually see things that you wouldn't know exist any other way. The Trust has 3D mammograms available, men's health exams, the access to the Ashland Quit Smoking program, and they of course put on the Cochise 5K every year. So all of those screenings that are on there are, except for the smoking program, are brought on site. So, and then everything on there is either covered by healthcare reform or it gets applied to that $500 wellness benefit. So you really, if you, for instance, if the city were to consider a high deductible health plan, all that basic health stuff is covered through here. Your physical is covered through healthcare reform. You can go and get all of your stuff and know all your health and never spend a dime if you are basically a healthy person. So here are the different plans for buy-ups. So CCT has 2 buy-up plans. They have the EPO buy-up plan, which reduces the deductibles to $250 and $750 for a family, and the maximum out of pocket to $2,000 for an individual and $6,000 for a family, and has 20% co-insurance. The City of Bisbee's buy-up plan reduces the deductibles to $500 for an individual, $1,000 for a family, decreases the max out of pocket to $3,000, $6,000, and keeps the that 10% co-insurance. On CCT, we also have a high deductible health plan, reduces those deductibles to $1,500, $3,000. There's 10% co-insurance until you hit the $3,000, $6,000. I don't even recommend people even consider that plan because max out of pocket is the same, and you're paying a premium every month. That money that you're paying could be going in your health savings account in case you ever do need medical care, instead of going into premiums that you will never see again. So, any questions on those? Okay, so let's talk rates. So just looking at the EPO plan compared to the City of Bisbee's PPO plan, I think what you'll see the most of is that the employee-only coverage through CCT plan is more expensive than the City of Bisbee's. All the other premiums are less. So I'm not sure what the percentage of premium that you're paying for your dependent premium is, but that's where you see the major difference in the 2 plans, is a little bit, CCT pushes more of the cost to the employee-only plan, and the dependent plus employee plans are less expensive than the City of Bisbee plan. And then the high deductible health plan, is less, of course, because it's just a less expensive plan to run. Any questions on the rates?
Is this per month?
Yes. So, just a little bit of information on how we determine the rates. So the rates on a self-funded plan are determined by an actuary based on actual utilization over years of utilization. So I don't know how much you know about actuaries, but they sit in a dark room someplace with a bunch of numbers and they determine trends. So based on, the prior 36 months rolling, this is where we estimate, based on your actual utilization, it will go. And then they look at national trends, and they say, okay, so specialty pharmacy is going like this, and medical right now is a little bit flatter than it was 2 years ago. It was more like this. And so they take those numbers, national trend numbers, plus what's actually happening with the trust, and they develop the funding rates, so the rates that the plan needs to pay claims, right? And then we add all the administrative fees. And the way that CCT operates is everything is at cost. So what you have right now is a fully insured plan, okay? So there's an insurance company that runs the plan, and they make money off of everything that everybody does. So they have people managing your pharmacy and people managing your claims getting processed and those kind of things. But they're making a profit too. And you probably are wondering, well then how do we make money, right, as the broker? How do you make money? We get paid a fee per employee per month. And we don't make any commission on anything. So you know exactly every dollar that our firm is making to manage all of the different pieces. So nobody's making commissions on any of the rates. So we put together the funding rates and all the administrative costs that go into managing the plan, and that is the rate. Kind of the beautiful thing about being self-insured, and Dan's going to attend our CCT renewal meetings where we basically go through the whole process of blowing up the plan, looking at it piece by piece and saying, this is what we're looking at for an increase, or no, not, depending on what the actuary comes back with. How do we want to deal with this? Is it a 2% increase that we can absorb into our budgets? Or is it a 10% increase because we had a terrible experience last year? And we're looking at an increase, a 10% increase, but none of the entities can support a 10% increase. We all sit there and decide what is the best thing for our people. So the management of each entity, they're the decision makers, and they will say, we don't want to raise the deductible because, or the co-pays, because the co-pays hit everyone. Okay, so the mom that's taking her kids, or the dad that's taking the kids to the doctor because they're little, those co-pays are going to hit everyone. They're not sick, they're just doing what they do, is growing up and cutting themselves and breaking little bones and those kinds of things. That's going to hit everybody all the time. What we want to do is we want to change the structure a little bit. We want to make sure that, those people that use it the most pay more by raising the maximum out of pocket or changing the co-insurance structure. The management makes those decisions based on what they believe is the best thing for their employees and their dependents. So you get full control over the plan design. And what we end up doing is coming back with a plan that everybody's happy with and meets their budgets. But you get that control, and that's the really beautiful part of self-insurance, is you don't get an offer back from your broker that says, hey, guess what, your insurance is going up 20% this year, here's your other option. Take it or leave. Pay the 20%, or take this other plan. You get to really make those decisions yourself. Yep.
Yeah, we've had that happen here, is we were told that, a few years ago, well, if this company's dying, this is your other option, and that's it.
Yeah.
And that other company's still around, by the way. They never went away, but that's kind of how we've been given it in the past is, you know what, it's going up, that's it.
Yeah.
No second option to look at. So.
And the benefit truly of being part of a pool like CCT is, first of all, the pool's been in existence since 2002, so it has that longevity. And I just totally lost that.
Dwayne has that effect.
The risk is spread out over more people. So the city of Bisbee is a smaller city. So if you have bad claims experience, if you have a few people that get incredibly sick, it can affect your rates for everybody, right? So it's like, that's the point of having insurance, right? Is to make sure that you don't lose your home and your cars and all of your financial security in the future because you got sick. But you feel bad because city gets a 20% increase, and then so it affects everybody. The beauty of taking 100 people at the city of Bisbee and putting them together with 1,100 employees in CCT is that a couple of really sick people don't affect your premiums. Because it's spread out over now 1,200 people instead of spread out over 100 people. Yep.
Stephanie, I just want to kind of give a little background on the costs up there. So that's the full cost of the insurance. That's not what the employees pay. The city pays approximately $500 per month per employee for insurance, and that's the same for everybody. So when you look at those numbers, you would subtract the 500 and then divide by 2, and that'd be your monthly amount. So if you look at, just the employee only, that one does go up. So that one, employee onlys could see an expense, but we also have that cafeteria plan of $67 a month. The spouse, that goes down, was at 90 or 130. The children goes down 40, and the family goes down 160 or 70 there. So those aren't the whole numbers. You have to think that you already get that $500. The city pays the first $500. And when we go into the budget talks, that is adjustable for the city.
So that, Dan, going to that, so the city would still pay that part, right? Like it wouldn't be put onto the,
Yes,
to the
so the
employee.
city would still pay that part as
We
well.
would just be switching plans.
It'd be just switching plans, so you don't get the $500, but in essence, the city pays the first $500-ish. So any drop you see there goes directly to you. The city isn't going to make the switch and say, well, we're going to take these savings and the employees won't see any. No, that's not the plan.
Right, and that's always a city decision how much they contribute to the plan.
And so Dan, you're saying that this is something that we would put into the budget hearings and present the new plan as part of the budget, and that possibly the budget could adjust to cover the price?
Yes, so the city council could elect to do a couple things. They could just do what they did last year and maintain the cafeteria plan at 67 and paying the first about 500. If they just did that, then the savings between the two plans there would be realized by the employees, except for the employee only. Or what I'm going to be presenting is more of a tiered approach. So, the amount the city funds depends on what plan you're in. Right now, the way it is, I not jokingly, but unfortunately call it a family fee. If you want to work for the city of Bisbee, it discourages you to have a family when it's, you're paying $850 a month. So I'd like to see a more tiered approach to that, where the city pays maybe a certain percentage of each plan or something like that. I'll be floating some new ideas to the council, but it'll be up to them. But if they just maintain the status quo, then it's gonna be the 500 per employee plus cafeteria plan.
Thank you.
And you probably haven't gotten your renewal yet from your current insurer, but I can share with you that we're basically going into a rate pass, so, yep.
And I wanna ask, by that you mean there's not going to be an increase, you're thinking for July 1? Is that what you meant?
I am.
Okay,
Yeah.
because last year, I think the rates increased, I don't know if it was 8 or 10% across the board for health, and that wasn't received very well, and the city council, I think they absorbed some of that, but what they ended up doing was they absorbed the employee only, so they increased the minimum contribution for everybody from like, I think that number's a little rough, it went from like 560, 70 to 590, or 490. So the city, they only helped out the employee-only plans, but everybody in a family, spouse, or children plan, the city council basically said, that's on you.
Yeah, so, and, last year, the Cochise Combined Trust had about a 2% increase overall, without any significant benefit changes. In this year, I can't say what they'll decide, but I'm guessing that we won't be making any plan changes, and if there are any premium changes, I'm thinking it's gonna be less than 1%. So, it's a happy year. It's a happy year for me.
And could you talk, we've talked about having the options, let's say we don't want a 10% increase, but we're maybe willing to adjust a benefit. There is a board, and the city will have one, I believe it's gonna be one member on there, so we do have a voting voice on that board that makes the decision along with the county and the college.
Yeah, so if the city of Bisbee did choose to join Cochise Combined Trust, you would have 2 votes. Okay, so the county has 2 votes, the college has 2 votes, and the city would have 2 votes. So you would have basically an equal vote to the county and the college to enter in those discussions, represent the employees of the city of Bisbee and their dependents, and have your vote, which is,
It's not a take it or leave it plan.
right. And there's a lot of, that's why I'm excited about Dan coming to our renewal meeting, and on the one hand, I'm really happy that we don't have anything to really talk about. On the other hand, I'm sorry that he's gonna miss out on a lot of the concessions that go on. So, Ed Gilligan may have something that he feels is really important to his people. And the college is like, we can take it or leave it. But the president of the college will say, I can see that this is important to Cochise County, so we're gonna agree to it. And so it may be something that they don't particularly want to do, but they can see that it's really important to Cochise County, and that's kind of how they work through those issues. The other side of this that is a really important part of self-insuring is the appeal process. So currently, all plans have an appeal process built into them where you go, you have something done, whatever, it's denied, right? You get a denial, and you have the ability to appeal through that insurance company to say, well, this is why this was actually an emergency. Because they say, oh, it was a non-emergency, it's not covered. And then somebody somewhere makes that decision and sends it back to you and says, nope, we still think it's not an emergency, it's not covered. You can request an IRO or an independent review outside if it's a if it meets the criteria for an IRO, which it doesn't always do, right? The beauty of being self-insured is these trusts are made up, the trustees, so the two people from each entity, are the final say on the plan. So I'm the first step. So once you appeal to the third-party administrator, the person that's paying the claims, to say, was this paid properly? Because I feel like this should have been covered. And they look at it and they go, no, it was a non-emergency, it's not covered. So you get the second denial. Then you reach out to me and you say, hey, I went through the third-party administrator and they denied it twice. So would you look at it? And I look at it and I say, because I'm the plan administrator, I look at it and I say, all right, what were the circumstances? Now, if it's something that's just clear, right, third-party administrator does their job. They look at the contract that's in the summary plan description and they make the decision based on the contract. They don't have any gray, okay? They just have black and white. It's either covered or it's not covered. That's for the plan to make the decision if on the gray areas. So if they say, no, it's not covered, then it comes to me and I look at it and I say, okay, well, now that I have all the facts, I believe they believed it was an emergency at the time. Maybe it didn't turn out to be, but based on the information that the employee or the dependent provided, it does appear that it was an emergency at the time. So I'm gonna go ahead and make an exception and have it covered. Now, if I can't, let's say I can't make that decision, I don't have enough information, then we set it up for the Board of Trustees to hear. So you can either give me all the information and I represent you and provide that information to the Board of Trustees, confidentially, of course, in an executive session where they're hearing about a person's personal health information, or in a public session, if it's all redacted and nobody knows who anybody's talking about. Or you can come, you can have your provider come and explain why that claim should have been covered for you or your dependent. And then the Board of Trustees will talk to the provider, they'll talk to the third-party administrator, they'll ask the questions, and then they make a decision. Many times, things that aren't covered on the plan, because of the circumstances, end up getting covered. Because the member had a compelling reason for getting care in a particular location, why they went to the emergency room, why they left an emergency room and went to another emergency room, all of the things. Because a big insurance company, and I'm not naysaying your current insurance company, but any insurance company, they just follow their document, and that's what they do. And these folks will listen to all the circumstances that are involved. They don't always approve them, but many times they do. So it just gives you that third level of, I have an opportunity to take advantage of this medical care. Any questions about the appeal process? Okay, so then just a little bit on the dental plan. So just comparisons across, the annual max per person on CCT's plan is $2,000, which is double what you have right now. The deductibles are basically the same, preventive care is the same, everything is the same, and then orthodontia is $2,500 for children, lifetime maximum, same thing on both plans except CCT's is $2,500 and the City of Bisbee's is $1,000. And CCT just raised theirs I think it was 2 years ago, just because $1,000 towards braces, I think they're like $8,000 now, so it's crazy expensive. Oops. Is that the end?
it, yeah.
The end. I gave you some handouts, basically a copy of the PowerPoint and tiny print Excel. I'm going to send that Excel to, I probably already have, haven't I? Did I send it to you in Excel, Dan?
I think I got it in the PDF.
Okay,
But I
I'll
will-
send it to
I'd
you.
like to get it in Excel, because it's hard to read.
Yeah, I'll send it to you in Excel, and then if anybody wants it, everything that's on there, and there's actually, if you unhide it, because there's all kinds of stuff hidden in there. If you unhide it, it's all of the plans all over the state, so might be fun to read, if you're a benefits person.
I've got two questions for
Yep.
you. Would the CCT see a benefit with the city of Bisbee joining? Would that help reduce the rates or anything along those lines?
Well, in the first year, of course, it's not gonna make any effect, because the city of Bisbee is self-insured, we don't even know. We just know based on the age of your employees and dependents and your history, your historical rate increases, that you are probably fairly healthy folks. We won't know whether it will benefit the plan until a year has gone by. But it always benefits when you have more people. So the bigger the trust is, the bigger the pool is, the more people that are on it, you're spreading that risk over more people. So it helps, keeps rates stable.
And then, on the HSA, you say you put money into it, does that money stay in and roll over, or is it every year?
It rolls over.
Okay.
Yeah. But the HSA is a huge, huge benefit. It's a game changer for, I mean, you can end up using it as a retirement account. So it's the best thing out there for,
That would be a whole nother, was it box of worms, can of worms to, I mean, we're open to, if we go down the HSA path with the high deductible health plan, that most of the time the city or the organization would increase their contributions to make contributions into your HSA because of the reduced rates. I think that's normal. So I mean, it's totally different. So if that's a path we go down, there'd be a lot more meetings and discussions about how to use that. Because it's a lot and it's complicated, and you have to be more of a capitalist when you're shopping for health insurance or services as well.
Yeah.
So.
I mean, it's a shopping thing. I mean, it's definitely a consumer awareness thing. Should the city of Bisbee decide to go forward with CCT and high deductible health plan is something that, I feel like it's something, especially when you get the families, that $6,000 max out of pocket and being able to put money tax-free before taxes into that account, that becomes a very attractive plan, especially when you're paying 100% of the dependent premium. It becomes a very, very attractive plan. Should you guys move forward with joining the trust, I would be here, my whole team will come out, we'll do all kinds of education on high deductible health plan, HSA, and everything else. I mean, we would, if Dan would let us,
It's not up to me.
do your whole open enrollment, all your open enrollment meetings for the first year, so that you can like ask questions until you're blue in the face. And I'm always available, so I gave you all my business cards. The best way to contact me is by email initially, because I'm on the road a lot, but I answer emails at all time of the day, at night, weekends, and everything else. So, but we would come out, we would do all your open enrollment, we would answer all those questions. The city would have made the decision about what all the plans they're going to offer, because 4 plans for 100 people is a lot. It's a lot of choices, but having choices is a good thing. So.
Awesome. Thank you.
Thank you so much.
This one was especially for Mr. Bourbon that requested it.
I have, yes, I've been asking for a long time about this.
I try to take care of you, man. I try to.
Thank you.
So if you end up with any questions,
Did it? So now I
don't hesitate to reach out to me. I'm happy to answer your questions.
And Dan, you can send the Excel documents when you get them to everybody?
Yes.
It's tiny for me too.
Yeah, no offense, I got that PDF and I go, what are they doing?
He's like, man, that Stephanie must be a young person to be able to read that.
So Stephanie, employee council's gonna keep going.
Okay,
You don't have to stay, and then we have another one at 1, hopefully some more people.
I'll be there.
All right, we'll see you soon, thank you.
Thank you.
We'll move on to item number 3, discussion regarding hostility directed towards city staff by members of our city council. Joe, since you asked for this to be placed on the agenda.
The hostility was too strong a word that I used there. Somebody explained what had happened at the city council meeting on the 18th of December, and I was very concerned that our fellow employees are being mistreated by the council. They're not being treated. I watched the video of that, and I was at the meeting last night too. But I don't feel like it's hostility, but there's a lot of power playing and showcasing that's being done by some of the members of the council with our employees, and they're asking questions for the camera and for the audience. And if they really wanted the answers, they would be asking the questions prior to the meeting, because you can't come to the meeting with all these answers. You know how that would work. And I just feel like they're they should be cooperative with us, because we work for them and they work for us. Most of us are constituents of theirs too. And it doesn't have to be acrimonious, and we're all part of a team. But instead of cooperating, we have this adversarial relationship that's starting to get set up, and I don't think it's healthy. And I just wanted to, that was really the problem, that I don't like the way that they're going after staff in some ways like that, especially with the questions. And I wish that we could communicate with them, and they would communicate with us a little bit better. That's all.
So I too listened to, I wasn't there for the December 18th meeting, but I had heard that there might be some feelings of acrimony. I listened to it, and I did not feel that council was unduly aggressive towards city staff. I actually appreciate council members asking questions. I think that they should always be asking questions, the more the merrier, because it is a public, because they can't speak as a group behind the scenes, or they will be violating open meeting laws. So if there are questions, doing it on the public dais, and especially for the public to hear these questions as well, I think that's important. My main concern was the previous meeting, which I now don't have the date, but it was about the New York contract for videography for the tourism office, and a council member went off topic and really attacked that department as a whole, attacked even the validity of the budget, but did it all in such a personal way that the manager of tourism was in the audience and felt personally attacked, and as a result quit. I mean, not that, I can't say that's the reason why, but that was directly after. The problem is process. There are a couple things, which is Robert's Rules of Order and speaking on topic to the agenda item, and the recourse is to call point of order, but people in the audience can't call point of order. Employees watching this, for me, as an employee, I felt that could be me. That department is mandated by budget, by a vote of the council. There should be no personal attack on the employee that holds that position. But in fact, when we are the employee that holds the position, we are the person doing that job. We do take it personally if that position is being attacked. And so it was not the agenda item. It was not relevant to the agenda item. But nobody stopped that council person. And so I think there were 50 people in the room for whatever reason, but the thing is that the only people, so any council member can call point of order. The other people who can do that, really, the two people who should have are the mayor or the city attorney. And Dan, I felt kind of bad for you in a sense, because as personnel director, you're a staff and not really able to call point of order, as are most of the people there. And so my concern is that because of what you kind of alluded to, Joe, is that there's this culture of acrimony happening on the dais, that they're forgetting themselves. They're forgetting that that should have been stopped immediately. Immediately. It was off point. It wasn't the agenda item. And so when nobody is taking the responsibility, the people who should be, the mayor and the city attorney, of calling point of order and bringing that council member back, it opens the door for that. Basically, he talked until he was done. And so I'm really concerned about an awareness of process, an awareness of Robert's Rules of Order, and awareness of the damage that council has already done and can do in the future. And so, and with disregarding our employees who work so hard, and disregarding the effect their words could be having. This is recorded, it's on TV, and so many people there who weren't the person who felt attacked, they also felt attacked on behalf of that. And so, I don't.
The council people were more involved with the employees, it seems like they used to be more. We were part of that, we felt like we were more part of a team, and I think that they felt like they were part of our team. But we're all part of the same body. They might be the head, and I might be a hand, or maybe a finger, but we should be working cooperatively instead of the way that it sometimes comes off that we're the enemy. They think if they don't like it, perhaps the man that we work for, that's not a reflection on us, and it shouldn't affect us, but I feel like it does.
Absolutely, and the thing is that where that council person was going was, that is a discussion for the budget hearings in the upcoming budget for the following year. But as of now, that department is funded, it's in the budget, and there's a job position. And so that issue of going so far off topic really bothered me for the damage that it did, and the feeling that employees aren't respected. And I don't know what the next step is. If this employee council, we had talked about it previously about, is it something we could write a letter and just, and again, not to be divisive, not to be acrimonious, but to remind council that we are the body that is implementing the decisions that they make. They make decisions on the dais that then we implement. And we need to feel supported in our positions, that we are not being jeopardized by these random outbursts.
I think we should individually talk to the council people about what our perceptions is, and maybe they can change their culture a little bit at this point. But it's something that we should probably keep an eye on, watchful waiting at this point. But it's just concerning.
Does anybody else have anything else to say regarding? We're going to move on to number 4, discussion and possible recommendations of the proposed policy amendments. A through I. This will be the second time we've heard these, so I think, Dan, you said these were all the input that you got.
Yes, so I've also added some more in the back as well. So I did take some of the feedback from the employee council and employees in general. So the first 8 or so I've already presented to you, and I can go to the new ones. Starting with Starting with the harassment policy updates, those are the ones that are coming to you guys the first time. I did send these out to all employees and the police and fire unions, but this is kind of the first step to get a recommendation from the employee council on these. So the first 8 or so were taken to Civil Service Commission once, an employee council once. On these last 4, this is the first time you're seeing them. But it's not like bylaws or ordinances where it needs to come to you guys twice, so you do have the ability to make a recommendation on all of these. And as we go through them, I'd like to put some Word documents up there, so if there's anything you don't like or want to change, I'll do that, so we could hopefully draft a recommendation and get a vote from you guys, because I'll be doing the same with the Civil Service Commission at the end of this month, and hopefully taking these to council in February. So I can just go over the new policies that you have not seen, and we'll go over, we'll touch back on the ones and the changes that were made. Again, each one has a little cover page about why we believe it needs to be changed. Then the policy as written with the black text original, the red text new, and then the old policy with the red line text of things that will be removed. So I'll just get started with the harassment policy. I think it needed to be broadened a little bit. It was really just a sexual harassment policy. And I think we should have language in there about all types of harassment, verbal harassment, non-verbal harassment, things of that, more examples, where they can report to. And I put something in here about confidentiality. Fortunately, we are a public organization, so any harassment complaint is subject to a public records request. So I put that, to the extent possible. And it talks a little bit more about retaliation as well, so filing a complaint you won't be retaliated. And so I just expanded the policy, so there's a part about harassment, then sexual harassment, and then a little bit more on retaliation. So I'm open to questions or moving on, or if you need more time, just let me know.
We went over this pretty thoroughly for the last, I think you sent it to us, 2 days ago?
Yes.
Last couple days at the union. The only thing I have questions or things about is the PTO buyout, but other than that, everything else that we saw as a whole, we agree with, and so as far as the fire department is concerned, we agree with.
Okay, then I'll go on the next one, the whistleblower. We don't have a whistleblower policy or statement in our manual at all, and whistleblowers protected, or whistleblower protections exist under, I think, 22 total federal laws, so it's nice to have a statement. And this just talks about, what can be reported, who it can be reported to, whose responsibility it is to investigate. Talks about the confidentiality, which, insofar as possible, but again, it's subject to public records requests. Who they can report to. And, I think there's a little bit more about retaliation here as well. Yeah, so in Part D, it talks about retaliation, how, whistleblowers shouldn't be subject to adverse employment action, termination, decreased compensation, poor work assignments, etc. Next, I do have the PTO cash out. So just the employee council made a recommendation for this a while ago. The city council gave direction to administration to pursue a policy. So the policy that I've drafted here after getting feedback, which I thought was a good balance, was that if you want to cash out some of your PTO, There are some caveats, which one, you should still leave 40 hours, so you shouldn't cash out all of your PTO. So it should be discouraged for you to use it all, because that could lead to instances where, any illness, you're taking leave without pay. And then you must have used at least 40 hours of PTO in the prior 12 months. And that's encouraging, again, our employees to not save it to increase pay, to actually use their time off, just to get people vacations and avoid burnout. And then the amount of PTO, I don't think that should be set in policy. I think that should be decided by city council and finance at the budget time, based on what we can afford. So if we're having a good year, we could say 80 hours. If it's a so-so year, 40. If it's a bad year, then
Could we
they
set a
could
minimum, or hope to set a minimum?
yeah, that could be used as well. So we could put, it's set, determined at budget time, but will always be a minimum of 40 hours per year. Would you support 40 hours per year minimum, and then,
I would say 40 hours for a 40-hour week employee, or 56 hours for a
Okay.
56-hour week employee.
You're saying as the minimum as a one-time cash out for the year?
Yes.
yes, so the total amount will be decided upon by council and finance based on finances, but it will always be a minimum of the 40 or 56.
Correct.
And so every year that would be during the budget hearings, and then every year council would just determine a number. So every year the employee council could also make a recommendation or
Yes.
be involved in that.
And then with the execution of that, it could happen at any time during that fiscal year. So July 1, they approve it, there isn't a window. You have all year to cash out that PTO anytime you want, as long as you've used some of your PTO and you're not clearing yourself out.
So as long as you use your PTO during that fiscal year, or as long during the calendar year?
The PTO cash out is gonna be on the budget year,
Okay.
but you must have used some leave within the last 12 months.
Gotcha.
That's kind of rolling.
Now, the only other thing is that you said that you want to leave 40 hours in there. We, again, came to a conclusion that for the fire department, if they have to leave 72 hours, because that covers us for 3 days, which
Okay.
in turn equals a week.
Okay, yeah, absolutely.
I did have a recommendation from employees in my department, which I think they had mentioned the last time and I brought up, but the idea of being able to gift PTO, it would be, and this is really great because this is really clear, and by delineating this with saying leaving a minimum of 40 or what have you, but for employees who have accrued so many hours, it would be only for an hourly exchange at the rate of that employee's hourly, not the rate of the giver, but the giftee. And the idea is actually that they could gift it for a number of things. If an employee had an emergency that they had ran through all of their PTO, employees could gather together and each give 5 hours to another employee to help them. It could simply be a gift. If they knew that they weren't going to be able to use it, they were only able to cash out a certain amount and, still have this excess that, that they could allow for an employee who maybe didn't have enough hours or what have you. Anyways, I thought it was a very interesting idea and they asked me to bring it to you. That it would be, and it would not be at all included in the monetary sense of that employee being able to cash it out. They either use it for time off or not.
I'm open to having that conversations. A lot of organizations have like a sick leave bank or sick leave donation, and I'm open to having that conversation. It's, now that I have my phrase, that'd be a whole can of worms, but I mean, that's something the employees want, and I'm open to that as well. I've only kind of taken these 12 policies as a priority right now, but I'm open to adding that as well, depending on what you guys want.
I think it'd be worth exploring. I was under the impression that was available in years past, but I don't know the truth behind that.
You know, it could be, I'd have to or I'd have to ask Nina to dig through the ordinances, because I've also heard there used to be PTO cash out as well, but I don't know what happened to that. So it was probably taken out by an ordinance, and I haven't dug it up.
So if this went into effect, this would be through ordinance?
Yeah, I think it would be included in the personnel, it would be included in this, and then this would be passed by ordinance? Yes, so employee council and civil service would make recommendations on the policy, HR would make recommendations and present to council, and they would, by ordinance, adopt these policies and put them into the personnel rules and regulations.
Well, I would like to request that we explore that, and, you know, just have some, maybe if we could, if people are interested in this, you know, have like, maybe it's a limit of 40 hours or 56 or 72, whatever that, you know.
I think it would have to be based on if the giver is going to be left, not the giver.
Right, well, that would be the caveat, is that they would have to stick to this thing. They could not go below 40. They would already have that cash out option, you know, and that if cash out is limited to 40, then they keep their 40, then they use what they only can, and then they still have this excess that they're gonna lose, you know, some kind of parameters, and that it could only be an exchange, but that would,
What if we can just create, like you said, a sick leave bank, something like that?
I mean, I'm open to it, but I would have to do a ton of research on it.
Right.
This is the result of the last year of research and policy, and like PTO, I've done the numbers with finance, so when I go to council, I can say what it's gonna cost. I would just have to do all that for a new policy. And I'm open to it, but you guys just need to put it on the next agenda, make the recommendation, and I'll do it.
What if we move forward with this, because this is the result of a year's worth of stuff, and then now we have another goal for next year? If that's good with you, I think that
Was
would
that
be.
based solely on
absolutely, or
department
could we,
individually
Dan,
or citywide?
As far as,
We can-
sorry, Andy, what was it, Allison?
so if we move forward with this, you know, approve as we go, but then move forward with this, and then even maybe during the budget hearings, would that be too soon for you to look at that and then amend it later on?
Well, a sick leave bank would be completely separate from
Okay.
PTO cash out. So I can't just add that to this policy. It would be just a new
separate thing.
policy
Okay, great.
that I could, you know, take through employee council, civil service, and then city council.
Fantastic, so we can put that on a different timeline and look at that.
Yeah,
as we're
absolutely.
Moving forward with this.
Yes.
I would like to recommend that.
Motion?
I move that we ask to look at a sick bank or donating a PTO bank. Thank you.
Actually, we can't motion that because it's not part of the.
Oh, okay.
All we can do is put it in like for comments, we'll just put it for the next.
For the next agenda. Okay, there we go, so we can move forward on this. Thank you.
Sorry, I wrote I itemized the policy, so I boxed this in, sorry. So then, what I heard from Ramon, minimum of, have the PTO cash out amount determined at budget time, but a minimum of 40 for 40-hour-a-week employees and 56 for fire. And then the other caveat was that fire employees shouldn't go below 72 hours on the books after that.
Yes.
If there's nothing else, I'm happy with that. Next one, the nepotism policy update. After going through the nepotism policy and having some issues here that I've seen in HR, there was no clause in our nepotism policy about supervisor-subordinate relationships whatsoever. So I've added that. And then I've also adjusted the term, instead of saying related, I defined familial relationship. Within the same restriction that was previously defined, I just used the term familial relationship, and then I added the term or acquires, so that if that relationship is acquired, then this policy is also in effect. But that one that's B, that's about supervisor, so I use the term direct or indirect administrative or operational authority over other persons. So even if you try to say, well, this person doesn't report to me, but you're working in the same facility, it's indirect, and that's not okay.
So basically it says you could not work in the same department.
No, it doesn't say that. It says if there's a operational authority.
Oh, okay. I wasn't clear on that. So if there was no authority whatsoever, they could conceivably work in the same department?
Yes.
Okay.
That would be like dispatch and police.
I was thinking about that, and I don't have an issue with, I know we have 2 married employees in dispatch and police. You could say dispatch is operational authority, but I see them as in different chains of command, just working together. If we want to change the wording on that so that they feel at ease, I'm open to that. I'm not trying to single anybody out, obviously. I don't believe we have any conflict of interest in the police department with the dispatcher being married to a police officer. I think we have 2 of those. Because I would say the dispatchers still answer to the deputy chief and the police officers still answer to their sergeant or the chief.
And the operational authority, or perceived, would be that dispatch is directing an officer, but that's part of the mandate of their job description, right? So hopefully it wouldn't cause a conflict.
I'm okay with that. I don't see any conflicts in the police department. If I went a little strong with the wording, I'll back off. I'm not married to this. Most important thing is we get something on the books, because right now there's nothing. You know, I could change it to direct administrative or operational authority.
I think it's really great, Dan. I really appreciate it, and I really think that it's forward-looking in terms of avoiding messy situations in the future. And as long as, I didn't perceive it as too strict, and I certainly appreciate individuals, but in a situational, this is not about individuals, this is about policy and about protecting departments so they can function properly. Does anybody else think this is too strong? No. I think you've really covered all the potentials, and hopefully it will be effective.
Thank you. Sounds like Jay's still thinking there, but
Yeah, it's not bad. The only thing I deal with when we come to direct or indirect administrative, when it comes to dispatch itself, dispatch works directly for the deputy chief. We as police officers, we report to the sergeant, but in turn, we still work for the deputy chief and the chief of police. So dispatchers do the same thing. So my concern, we talk about indirect administration, it still falls in that line, but we still report to the same exact, we still work for the same 2 heads in that department. And that's ultimately who's going to decide our fate on both sides of that spectrum. That's where my concern comes in when it comes to a dispatcher being married to a police officer. Numbers wise, we don't have a lot of numbers anyway, we all know that. So that's where my concern would be. We still fall in that same line because we are taking work for the deputy chief.
well, why don't we just take out direct or indirect and say shall not have administrative or operational authority?
Yeah, because I know when coming from DOC prior to this, that's how it was there. As long as there was no You did not work for that person. They had no authority over you as far as supervising you. You could actually be married. My wife and I were married. We worked in the same place. But I had no authority over her. We just couldn't be on the same shift together, the same unit. We could still do the same job. It's kind of the same thing. I just couldn't manage her, being a captain or anything like that. But when I brought her to captain, she was a CO4. We were actually on the same unit together, working the same exact unit. So that's just my concern when it comes to our agency in that clause there.
Yeah, I think, you know, we're a small agency in a smaller town, in a rural area, you know, there's certain things you can't
Yeah, we
avoid
have those
based on the
things, yeah.
workforce. Why don't we just call it, say, shall not have administrative or operational authority? I'm fine with that, and we'll take that out.
That's better.
Might have gotten a little wordy with that one.
You're using a thesaurus there?
So those were the 3 or 4 new policies that you guys saw for the first time, and I can go over the other ones and some of the changes you guys recommended. Right, so the other one was going back to the definition section. I had some comments from Yvonne and Cindy, and I updated the unclassified employees to take some language out of there about contractors, because they shouldn't ever be considered an employee. The next one, the appointment to a city position. I itemized the job descriptions, but I also added, I think we added the gift shop ticket sales because they're handling public funds. And I also left the generic language in there, so it's itemized, but also says any other classification that may handle public funds, access to children without direct supervision, or access to confidential information. And just to gloss over some of them, for those of you that weren't here last time, the next one, evaluation of applicants. I changed some of the language, so we call it assessments. And then I removed one term in there that kind of bothered me. It said each. Let me find that. Where if you put that in there, it means that I think the meaning is they want all applicants to be treated the same, which is how they are. And I've wrote it, candidates will be provided with the substantially same opportunity to demonstrate his or her skills. However, they include the term each, which means that basically I would have to interview every single person. And that's not really feasible. I can't do that. So just back that off, but it still says everybody gets the same assessment for a job. So for police officers, one person wouldn't get a mile run and the other person gets a mile and a half. There were no comments from you guys on that one, I don't think. And then internal hires, our current policy prohibits vacancies from being filled internally. So, you know, we've just seen with the fire lieutenants, captains, police sergeants, even operations manager, those were all, not that I have a problem with going to the public, but it was all mandatory that they were public. And, you know, these guys have been in these positions interim for a while, and they had to compete with the general public as well for them. So I added a clause there so that we could, with permission of the city manager, do internal recruitments. And I would anticipate that being mostly in public safety. We had the we had some stuff about probationary employees, how it cleared up who would have a 6 and 12-month probation, and the 12-month would be newly hired public safety officers. So police officers, dispatchers, and firefighter, EMTs, and paramedics that are newly hired, but internal promotions would get the 6-month probation. And then the most important thing here is that promotional probation if you fail to meet the requirements, you don't get cut loose. So, for example, if you get promoted to fire lieutenant, police sergeant, and it's not your thing, we're not gonna say, oh, you're fired. You get to bust back down to the job in which you were already doing. And, and then the alternative appointments where we define temporary, emergency, seasonal, acting, interim. There were some comments about the length of time. I mean, I feel comfortable with not having a maximum. And I don't know where you guys landed on that, but I'm happy with the alternative appointments text as it's written. And I think this is a big improvement because previously, I mean, frankly, we were just kind of flying by the seat of our pants here. The fire guys, they were all acting captains and acting lieutenants for 18 months, but the police department was calling people interim, and they're not the same. They have different repercussions when you're talking about exempt, non-exempt, classified, unclassified, regular probation. There's some nuances to it in the HR side that need to be defined. The last thing, interim, you guys were talking about, should there be a minimum or I'm sorry, a maximum or a conversion, but I don't feel the need, but if you guys speak up, it'll go in a recommendation.
I'm looking for the page that's on.
So it would be, the order's not perfect, but it's the Chapter 3, Section 7, alternative appointments.
So before interim positions were up to 6 months at the at the end of 6 months, they would return to their other salary position. And that's being taken out, is what you're saying?
Yes, previously there were no definitions of any of these. It was just all called temporary assignments for maximum 6 months. But unfortunately what happened is it was just abused. Deputy chief was in an interim position for 24 months. The fire guys, there were 5 of them in acting positions for almost 18 months. This was just blatantly ignored. But now with this, there's actually definitions of what each type of appointment is. And I did take out the clause for maximum.
So that means somebody could be interim indefinitely?
I mean, it's possible. I'd have to be asleep at the wheel for that to happen, but I mean, it's possible.
But does that put the oversight on your position, then on personnel director?
Well,
So if it's indefinite, so say it wasn't you and somebody was asleep at the wheel, there's no language for the position for like direction. By taking off the time limit, you're taking out the parameters, it could be indefinite.
that's true, but we also have the Employee Council and the Civil Service Commission. So there's 3 layers of judgment there.
Does anybody else have any thoughts on that? And my concern
I think you
is
need to
that-
define a time frame.
I think we do too, because the thing is you can say civil service and employee council, but how on earth could they defend a document that has no time limit? If employee council or civil service said, this is too long, the person would just refer back to the document that says there's no time limit.
Yeah, I can put it in there. So
I
it's
can-
12 months, what
I
do
would
we?
say no longer than 12 months, because initially, when we were told we were going to be acting positions, it was just until whenever the hiring process happened. Hiring process didn't happen, we went through a different chief, different city managers, different HR directors, like, everything just got it just went everywhere. Yeah, so I would say within 12 months, because if you get put into a acting or interim position in July, the budget is already set until June 30th of next year. So, in my opinion, I would say no more than 12 months.
Or upon 12 months review.
Well, that's totally set.
Yeah, I would agree with 12 months. I mean, because the point is that they should, like, when we had an acting city manager, you know, because it was limited to 6 months, the mandate was for council to hire a new city manager. So if there is an interim or an acting, it's because there's a mandate to fill that position permanently. But if you can avoid going through the correct process to fill that with a permanent member and just keep an indefinite interim or acting person, then you're avoiding the following process and procedure of the permanent employee, filling that with the permanent employee. I think 12 months is quite a long time to find an employee.
Then I'll add that for the interim appointments. That's what you guys want?
No more than 12 months? Because again,
Yes.
if you get placed into the interim position July 2, the budget for that year is already set, so there's no money to put you into that position permanently. You understand what I'm saying? And then June 30th is the last day, so the next July 1st, theoretically, there will be new money to put you into that position.
That's
permanently.
only if it was an unbudgeted position, right?
Yes, no, kinda.
All right, you guys got it, 12 months, not to exceed.
Yeah, not more than 12 months, that's what
Okay,
Okay.
thank you, I agree with that. I like the way you
All right, and the last one, the infamous volunteer policy. Last time, the only issue was with Part C3, should employees be allowed to volunteer? I'm okay with it. You guys had some misgivings, so it's time to
Can I make a side note? I just wanted to say, you know, it's really great to have these parameters, but also we had a volunteer open house in November, gotten another 10 or 15. So, I mean, that's a huge amount of people willing to volunteer for the library, but also a lot of work for you, Dan. We understand that, and having these packets, these revised packets, and the ability for you to collect them and vet them and everything, we really appreciate it because this volunteer workforce is really assisting us. So, I mean, it's a huge number, and I just wanted to thank you for that and putting these in place.
Thank you.
I still don't think that we should be able to volunteer for our own department, personally. I mean, I understand the things that were said before, I really have been looking at it. I think that it's a bigger picture. I think that some departments get budgeted for overtime and other departments don't get budgeted for overtime during the budget process. And there are some other things that each department, fire and police are different. The library is different. Different departments have different hours, different parameters. And it would be nice that, I'm not saying that we have to change this now, it's just my opinion, but that during the budget process and the budget hearings, that we really take a look at who is volunteering for their own department and why there isn't money to pay them. Because if we're employees and we're working towards this goal, what can we do to budget for overtime? So that those employees who, because while this looks like civic volunteerism on paper, there are simply times when employees don't have the overtime budgeted and they just have to work to do their job. And it's called volunteering for their department. And I think it's a bigger picture, and it would be nice to look at that, to protect the employees.
Didn't the attorney tell us that we weren't supposed to do that?
The attorney